Welcome to Adapt NCLEX. This is NCLEX review on leukemia. I will give you the content that you need, and then we will practice some questions. So stay around, short lecture, good high yield content related to the question. So what do you need to know about this problem? If you know it, this is just summary for you. But leukemia, what is leukemia? The first thing you have to know. Everybody have heard leukemia about it, but just know that it's a broad category of cancers that usually affect the bone marrow and the blood. That is the key. So these affect bone marrow and the blood. The problem is, if you hear about leukemia, know that you are having abnormal, so there is abnormal, basically production of either the immature or dysfunctional, mostly white blood cells. So you making leukemia is associated with the and blood-borne disease or bone marrow related cancers that leads to production of immature dysfunctional red blood cells. And there's types, okay? There's types of leukemia. Easy way to remember it is one will be acute versus chronic. That's all. And it's going to be either lymphocytes or myelocytes. That's all. And that is the way you can basically figure out what is going on. So myelocytes or lymphocytes. So you have the first one, you have what we call ALL. So this is acute lymphocytic leukemia. The word acute means it's bad, it's rapid. You can die from it quickly, mostly found in children. And you have a rapid progression. That is the difference. Every acute problem is rapid progression. So these need to be treated as soon as possible. Otherwise, you die. That's why it's called acute. If it's not acute, it's called chronic, right? Lymphocytic leukemia. This one is found in older patients, older clients, and they may progress slowly, right? Sometimes they do what we call watch and wait. They don't treat it until you get sick from it. So this is the lymphocyte. You also can think about what? Acute myelocyte, myelogenous, that's what we call it. Leukemia. So far as it's an acute, you got to treat it, but this is usually in an adult patient, and then there's a rapid um, progression. So it need to be treated as soon as possible. The second one is what? Chronic. As you can see, it's just straightforward. But when you see them, it's very worrisome. Chronic myelogenous leukemia. This is older adults. But most of the time, I would say any age, right? Any age group, but mostly older adults, right? There's a chronic phase, that is where is waiting from, then it can go to acute phase. There's something we call Philadelphia chromosome mutation. This is what is associated with that. So these are key information for you to know quickly related to the disease process. But that's not what your NCLEX need to, it will not end there. First, you have to know this information, and then you have to know what clinical manifestation. So presentation, how will you know that this patient has leukemia? The general symptoms I call it B symptoms. It's the same thing, lymphoma, B lymphoma symptoms, which everybody know, like TB. If you know anybody who have TB, yeah, you can use the same information for leukemia. They're going to have fatigue. They're going to have fever, mostly night sweats. They're going to have weight loss. They're going to have frequent infection. These are things you see um, related to the disease process. So those are symptoms we call B symptoms. They may also have some bone pain, especially if it's and this bone pain, the bone marrow. So you have overcrowding of the bone marrow. This is what is causing the problem. Okay. Everything everybody should know is that when the bone marrow um, is overcrowded, what is going to happen? You lose production of red blood cell, white blood cell, and then platelet. And therefore, the individual will have anemia. This is something you should be familiar with every time you hear about leukemia. Anemia due to red blood cells, so the skin will look pale, right? And they will have dyspnea on exertion. These are all things that you should be, and they will have fatigue. In terms of the platelet, which is a thrombocytopenia, because you can make platelet, you're making the leukemia cells, so you have low platelets, so you have easy bruising, right? That's a key feature. And of course, petechia, you see them, they may have petechia, they may have nosebleed, right? And they may have um, other symptoms related to platelet dysfunction. And their lymph nodes, they have like lymphedema, basically, or you can say lymphadenopathy. Basically, lymph node get bigger, or their spleen bigger, spleen enlarged. And then they may have risks of infection. Why? Because the leukemia cells, even though they're making white cells, they are immature. And so they don't fight infection well like any other cell. So you make a lot of white cells, but they don't fight infection. What is the next intervention? Don't forget, this is what always know something about next intervention for this disease process. Every time you learn something, don't learn it just like if you learn about appendicitis, ask yourself, what is it going to do? What is the next going to do? Infection, of course, risks of infection. So neutropenic precaution, that's what you do. So number one is what? When you're taking care of this patient, number one is what? You want to make sure that you wash your hands, hand washing or hand hygiene extensively as much as possible to prevent infection. So washing with soap and water is the key. Then you have to advise this patient about neutropenic precautions. So avoid crowds, right? Um, no live vaccine. They need to do hand hygiene, right? And they should avoid fresh vegetables or uncooked meat, like hot dogs. You should avoid it. Those are little things you would teach them. Then the next one is basically bleeding, basically in terms of a bleeding. So you teach them not um to bleeding issue. So basically, what do you think you tell them? No aspirin, right? NSAID, avoid NSAIDs and like aspirin product. You can tell them to soft Bristol toothbrush so that they don't bleed. In terms of their energy, you can teach them, you can teach them to, you should teach them to like frequent rest, take frequent rest. They need some, and then calorie. They need high, small. So what we call is small, frequent, high calorie diet. So that's what you give them as much as possible. Hydration is also good. Okay. You have to monitor their lab. So lab work, frequent lab check like CBC. This is checking for their platelets. This is checking for their white count and their hemoglobin. If they need blood, you want to transfuse them. Some pharmacology that you should know a little bit about this problem is a very quick farm that you should know, quick farm related to that. So what farm do you have to know? 3 medications. Sometimes we got to give them something for their white count. We call them Filgrastim. One of them is Filgrastim. So if you don't know them, their last name is the Grastim. So Grastim is their last name. So I'll highlight that. And so all of them have Grastim. One of them is Filgrastim. It increases your white count. If you want to increase their platelet, we call it Opralvelkin. And if you want to increase their RBC, you give them epoetin alpha. So these are 3 medications you should be familiar with. Okay, when you're treating them, what is the treatment? Treatment, they get chemotherapy. They can get sick from the chemotherapy, which is common signs and symptoms that you have to know. They may have nausea, they may have vomiting, they may air loss, they have mucositis, that is the mucosa of their mouth will get inflamed. They can drink anything, and they have bone marrow suppression. So these are certain things you need to know as much as possible. Remember, during tumor chemotherapy, they can develop what we call tumor lysis syndrome. What is that? Let me show you. You have the tumor cells. So you have tumor cells. This is the tumor cells. Usually you have a lot of potassium in the cell, right? You have a lot of phosphorus in the cell. And then you have DNA, which is uric acid. You have calcium outside. When you blast this with chemo, what will happen? The cell bursts. When it bursts, it releases more potassium. The potassium go up, increase your phosphorus, right? The calcium gets chewed by the phosphorus. It binds to that. So your calcium go down. And then your uric acid, this is DNA. You have a lot of uric acid. Uric acid. This is what we call tumor lysis syndrome. The treatment, whatever medication you know to treat potassium, use it, like furosemide, hydration, insulin, glucose to get rid of the potassium, or polystyrene like K-isolate, right? Whatever you need to you do to decrease the phosphorus, right? Phosphorus binder. You may have to give them calcium, and then you got to bind to uric acid, prevent uric acid breakdown. Allopurinol is one of those medications. But this is where you have to apply your content, manage their potassium that is too high, manage their phosphorus that is too high. They may need to be in the ICU. They may need the EKG to make sure there's no EKG changes. You have to give them furosemide, hydration. First thing you should do is number 1, hydration. Give them a lot of fluid. This will wash out everything. Remember, their kidney function is going to be affected. So hydration is the key. This is a brief summary of leukemia, how to manage it, tumor lysis syndrome, what medication you should expect to know in the very short time. This is content mastering. at that NCLEX. So let's get to the question, and you see how you can apply. This is NCLEX question practice. A client with leukemia who has what? Low platelet. Which intervention is the most appropriate? Low platelet, bleeding. Pick an answer choice that is related to bleeding. This is how you answer question. Don't even think too much. Encourage the patient to perform light exercise. It's not going to lead to bleeding. Advise the client to use soft what? Bristol's toothbrush. Yes, so that your mouth doesn't bleed. Encourage diet high in iron. I'm talking about platelet bleeding. Place the patient in the private room. This is not leukocytes. It's not a problem. So the right answer is B. And this is providing education to a client with leukemia who is about to start chemotherapy. Which statement by the client indicate the need for further teaching? Keyword, buzzword, chemotherapy. What do you need to teach them? I should report any signs of infection immediately. Yeah, when you have a chemotherapy immunocompromised, you should report signs of infection. I should take the aspirin if I have headache. Your platelet is going to go down. You may bleed. You should not take aspirin. I should rest when I feel tired. Yeah, frequent rest is good because of anemia. I will need regular blood tests to check what is going on. So the right answer is B. You should not take aspirin when you have a headache. A client with acute myelogenous leukemia is receiving induction chemotherapy. All this information is irrelevant. Patient has chemotherapy. He has leukemia, is getting chemotherapy. Even if you don't know acute myelogenous, focus on leukemia. The client laboratory results are follow. Y count of 0.8. That is very low, right? Hemoglobin 7.5 is also low, but it's okay. Platelets of 18,000. No, 180,000. So that's okay. It's within normal limit. Which nursing intervention is the most appropriate at this time? Place the patient in the negative pressure room. This is not contact airborne precaution. Administer oxygen and elevate the head of the bed. There's nothing in the question telling you this patient is having oxygen issue. This is fine, but it's not appropriate related to the question. Use strict hand hygiene in private room. C is much better. Encourage the patient to ambulate in the hallway 3 times. It does not answer the question. The key question is Y count of 0.8 is not good. So the right answer is what? Strict hand hygiene and private room. That's C. And this is assessing a client with chronic myelogenous leukemia. Once again, if you don't know what CML is, you see leukemia, treat it like any other leukemia. Who is on what? Cleavage, imatinib therapy. The client report fatigue, swelling ankle, and sudden weight gain of 4 pounds in 1 week. Which action should the nurse take? Look, there's some medication you will never seen before, but the board will ask you. They will give you a bunch of information in the question to help you. I give you imatinib, and I give you signs and symptoms of fluid overloaded. What do you think you should do? Manage fluid overloaded. Don't worry about, oh, I don't know this medication, so I pick any answer choice. Fatigue, swollen ankle, and sudden weight gain of 4 pounds in a week is fluid overloaded. Therefore, assess the client for signs of fluid overload and notify the healthcare provider. These answer the question. The other options is irrelevant. Document the finding as expected side effect. No, fatigue, swelling, and even though it is a side effect, you should not document it and leave it alone. Patient is not doing well. Ensure the patient to reduce dietary intake. Bad side effect. So you should do something about it. The pediatric client with lymphocytic leukemia has developed tumor lysis syndrome following the start of chemotherapy. Which physician order should the next question? I told you high potassium, high phosphorus, low calcium, and a high uric acid. Administer allopurinol. It will take care of the uric acid. You don't need to question. Start IV fluid. You're going to hydrate the patient. Administer potassium chloride. No, potassium is already high. Monitor electrolyte every 4 hours is good. Therefore, 3C is wrong. The next is educating a client with CLL about a potential signs of disease progression. Which client statement indicate need for further teaching? Question, need for further teaching. That means the They've been taught by they saying something bad. We're looking for progression of the disease. So signs and symptoms of leukemia will progress. I should notify my provider if I start feeling more tired, iron deficiency, anemia. If I have frequent night sweat, I should let my healthcare provider signs and symptoms of leukemia. As long as I don't have swollen lymph node, I know my disease is stable. That's not true. I will keep track of my weight loss and changing appetite. That's great. Therefore, which need further teaching? C, need further teaching. The client with acute leukemia is being monitored for complication related to treatment. The next notice that the client has increased bruising, right? That's platelet problem. And nosebleed, that is difficult to stop, nosebleed. And blood in the urine, that's platelet dysfunction. What is the most appropriate intervention? Administer a prescribed dose of acetaminophen. Yeah, you should not take NSAID. Hold all anticoagulation and notify the air care provider. That's really bad. That's a good one, right? Encourage the patient to increase fluid intake to flush out any blood in the urine. That's not bad. Apply warm compression to area with bruising to promote blood flow. It's going to bleed. Therefore, which one is the best answer? Best answer is what? Hold or anticoagulation, and that is B. The patient is already having bleeding. Do you want them to bleed more? This is our adapting class content review related to leukemia. Last question. And this is caring for a patient who is undergoing high-dose chemotherapy for acute leukemia and develop oral mucositis. Which of the following interventions should the nurse include in a patient plan of care? What is mucositis? That means your mouth is all sore. You can't drink anything. Therefore, soft Bristol stool is better. A soft Bristol toothbrush is better for oral hygiene. Encourage the patient to rinse their mouth with alcohol-based mouthwash. It's going to burn if you use alcohol-based. So B is wrong. Offer cold blended food to reduce oral discomfort. Yeah, this may help. Administer prescribed analgesic before meal. Yeah, give them something to eat before pain medication before they eat. So D is right. Instruct the patient to avoid acidic and spicy food. It's going to make them what? Painful from the mucositis. Therefore, that is good. What are the right answers? So the only wrong answer is B. So this is good. This is good. This is good. This is adapting class. Thank you for joining us. Thank you for watching. Take care of yourself. Bye.